after initial tests have been carried out on a patient, such as a physical examination, a mammogram, magnet resonance imaging, an ultrasound, or a ductogram, etc. The next step may be for a biopsy to be given, although this will usually depend on whether anything suspicious has been found in the breast of the patient that could indicate a breast tumor. The biopsy is the only real way of telling whether cancer exists in the breast of a patient or not, and may include the following: fine needle aspiration, Fna Biopsy. A fine hollow needle attached to a syringe is inserted into the breast mass where aspirate. A small amount of tissue is withdrawn, which can later be examined under a microscope. A local anesthetic may be given to the patient to numb the breast area before the biopsy takes place. However, although this is not always the case and may depend largely on where the breast mass is situated. If the lump can be felt, the needle will be guided into the mass while the doctor is palpitating, feeling the breast. However, if it cannot be felt, the biopsy may be carried out with the use of ultrasound, where the doctor can guide the needle while at the same time watch its movements on a computer screen. Once the needle is in place, fluid can be drawn out from the mass where it can then be examined. If the fluid is clear, then the indication is that a benign, non-cancerous cyst exists. However, if the fluid is of a cloudy or bloody consistency, then there is the remote possibility that it could be malignant, cancerous. When the mass is found to be solid, and particles, small tissue fragments, are drawn out, there is a more certain probability that cancer exists. However, these fragments will need to be examined first by a pathologist, a specialist who studies blood and tissue fluid, before any conclusions can be made and before any treatments can be offered. Although Fna biopsies are commonly used, they are susceptible to certain disadvantages, which can include either the needle not being placed within the cancer cell resulting in the diagnosis being inconclusive and unable to determine if the cancer is invasive, infiltrating, or not, or insufficient cancer cells being withdrawn resulting in a cell shortage for certain lab tests that may be needed. If the Fna is found to be inconclusive, then other biopsy methods may be used, including core needle biopsies, vacuum-assisted biopsies, or surgical, open surgery biopsies. These biopsy methods offer a more conclusive diagnosis of any breast mass that may exist, and where more information can be found about them in How Breast Cancer is Diagnosed, Part 3, which will also conclude this three-part series.